Hello, everyone. I'm Dr. Diana Bitner, and this is Susanne Pettigrew, our PA at True Women's Health. We're here tonight to continue our series on Let's Chat tonight we're going to Let's Chat about the MonaLisa Laser Touch. Basically, we want to stop beating around the bush and talk about treatments for painful sex. And this is one of the best treatments for painful sex, and we're going to talk about this. But very briefly, first of all, want to point out that if you ask questions on the Let's Chat, then we'll see them in that window to be able to answer them tonight. If you're watching this after the fact, not live, feel free to send questions in our comment page on our Facebook page, or you can private message and we'll get back to you with that. Please share and like this. We need more women to understand this information. And another bookkeeping or housekeeping is that we now have a special landing page on our Facebook page about the MonaLisa Laser Touch. So you can go into the landing page and get information about MonaLisa. There are the commonly answered or commonly asked questions. And we also have gift certificates available if you are a partner, a friend, a sister, a mother of someone who's suffering from these conditions. We welcome you to go to the page and be able to purchase the gift certificate and give the gift of feeling better down there. So, and hello, Helen, listening from Australia. So glad that you're joining us tonight. Just gave me shivers. We're talking to people across the nation or across the globe. That's pretty great.
Great.
In starting to talk about this, I want to talk about why I care about this. I care about this because I know that 78 million women in this country, just this country alone, I don't know how many in Australia, but just in this country alone are in menopause. And this is women of all ages. And women in menopause, 80% of them suffer from symptoms of low estrogen, including vaginal dryness, bladder urgency, bladder urge incontinence, and painful intercourse. Too many women suffer from this, and I want to see more of those women in our office and see these women get across the globe get help for this condition. And tonight we're going to chat about a very effective treatment called the MonaLisa Touch. So I care about this because women deserve to know. Susanne, I know this is also something you care very much about. She is in our office tonight talking to us from True Women's Health.
Yes, I am.
Susanne, why do you care about this?
Oh my gosh, I care so much about this. Just, MonaLisa just gives us another option. I care because I want my patients to have a choice, and a one-size-fits-all treatment plan certainly doesn't fit this topic at all. It's such a common problem, and it's so uncomfortable and distressing to women, and it changes life in a very meaningful and disruptive way. And so it's really important that women have choices to really be able to pick what's best for them. As an example, a 30-year-old woman who enters premature menopause using the traditional vaginal insert for estrogen might not be what she wants to do for the next 50 years. And so MonaLisa Touch is something that gives her an excellent other option. And so because it's such a distressing and common problem, this is such an important topic to be discussing tonight and to really talk about this new exciting treatment that we have available now.
I love that. And again, I also think about all the partners that suffer. This is something that is really difficult to talk about. A couple Let's Chat ago, we had a patient, Tammy, on the Facebook Live, and she talked about how her husband didn't know how to bring it up. He wanted to be always the good guy and really be supportive of her, at 32 going through breast cancer. And he was really afraid to bring up how he really missed sex. He really missed, not just from the physical act, but from the intimacy, from the being together. And, Tammy talked about how she also really missed it in the sense of, that being something easy. She sees her friends at coffee or, wherever, and they're talking about having sex and like, oh, maybe I'm not in the mood or whatever, but they can have it if they want it. And she said, even if I want to have sex now, I can't because it hurts too much.
And it affects relationship in such a deeply intimate way. I mean, couples relate to each other in a meaningful way with having sex. And one example I always go back to is because my niche is cancer survivorship, and so so much has happened to cancer survivors throughout their treatment, and they've given up so much and they've lost so much, and so sometimes that on top of everything else, having to lose that connection and intimacy, it's just one more thing that they have to put up with. And sometimes it's an issue of so much uncomfortable conversation happens during that journey that sometimes the intimacy is just a really way that's important for couples to connect.
Exactly. And we talk about in terms of being sexually intimate, we talk about outer course and intercourse, and sometimes having outer course is enough, but there's so much about intercourse and penetration that can really be intimate and close, and couples really miss that. And again, we're here tonight to talk about MonaLisa Touch because it provides a safe alternative to estrogen for women who choose not to use estrogen, or women who shouldn't use estrogen because they have an estrogen-dependent cancer. MonaLisa Touch is a carbon dioxide or a CO2 laser that's non-hormonal and it's chemical free. And Susanne, it's sitting right behind Susanne. And so we just wanted to showcase that it's this very, small piece of equipment that's not scary. And, we really took a chance to, add this to our business plan and borrow money to buy this MonaLisa laser. We really took a chance with this because we so want to be able to provide this therapy for women and, again, treat this condition. So, we're very proud to offer this therapy. Again, Susanne, do you want to talk a little bit about how it works?
Yeah, again, as you said, MonaLisa Touch is a laser therapy. It's a CO2 laser therapy. It works by causing pinpoint spots of damage to the vulvar and vaginal skin, leaving surrounding tissue normal. And so this causes new tissue and new cells to regenerate in that damaged area, and collagen production increases. So as a result, there's more blood flow, there's healthier tissue that grows back. So women really notice improvement in things like moisture and elasticity and comfort because of that. And so it's a really big breakthrough for us to be able to offer this service at True.
Sure. And what I love about this is, those of you who know me, I really want to provide evidence-based treatments. So we're using treatments that have been what's called peer review published. So what this means is companies or researchers do research on a specific therapy and then compare it with placebo. And so this is the only laser for GYN conditions that has been studied with a sham control, meaning patients are provided either a sham, like a pretend laser, versus a real laser, and then the results are studied over a course of time. And there was a trial done called the Velvet trial, and it shows that this treatment is as effective as estrogen. So the cool thing is that we know that this works from the studies, right? And these studies look at very specific things. So this isn't just someone saying, especially the salesperson of the company, this isn't someone saying, oh, we work, it works, and someone said it does, so hey, you should have it too. This is something that researchers have studied with significant rigor, meaning they're measuring the pH or the acid level of the tissues. They're measuring, what the tissue looks like. They're measuring the actual diameter of the vagina. They're measuring those things that really matter, as well as using a scale with patients that rates from, we use the smiley face pain score to rate pain, dryness, itching, and bladder issues with this. And so these studies have been done to show that, again, this MonaLisa laser is as effective as estrogen. The other thing is I like to understand how this really works in a very practical way. It's not voodoo magic. So what I want you to think about, for those of you out there who sew at all, or just think about the elastic in a pair of, let's say, sweatpants. So think about, in our skin, collagen is like that elastic. And so, when you buy a new pair of sweatpants, the waistband is really springy. And that's because the elastic is sewn in, so it's sewn, so when you stretch it, it's flat, and when you let the elastic waistband go, it springs back, right? So our collagen in our skin, when it's really healthy and there's estrogen and there's good blood flow, the collagen is really springy. So when you're just sitting there now listening to me, your vagina is not expanded. It's just sitting there like closed, whatever. And so, with intercourse, it has to expand so it doesn't hurt. And so what happens is that with menopause and loss of estrogen, the collagen gets dry and it gets brittle. So you know how when you pull out your swimming trunks from last season and they've been in your drawer all winter and you pull them out and it cracks? It's like that rotten, broken, dried up elastic. That's what the collagen is like in menopause. So I know that's not a pretty picture, but this is what the MonaLisa does, is it drills little holes in the skin, little holes that are very, well, Susanne will talk about it. It's very tolerable from a pain standpoint. They're just tiny little holes, and what it does is it creates a healing process that allows the blood flow in this collagen to get nice and springy again. So that's the cool thing. And MonaLisa does it in a proprietary pattern that can change depending on where we do it on the bottom.
Good explanation. I love those analogies that you gave. That really helps us to kind of imagine what this is actually doing to us. That's really good.
And what's really fun is that Susanne and I talk about this because, again, we can read the papers, we go to the meetings and hear people lecture about this, but to now see what happens with our patients. So we follow the protocol that Suzanne's going to talk about. But for example, we use a dilator in our patients at the consult and measure how wide the vagina will open. And then even after the first treatment, we've already seen that the opening expands by using the same dilator set to measure how that changes. Suzanne, do you want to talk a little bit about what happens?
Yeah, I mean, just extending on what you just said. I mean, I enjoy that patients are really impressed by the difference in sizes of dilator. That because I show them the size. This is where you started, and this is where you are at now. And so, thus far we have been so impressed with just the positive results that women are experiencing with this. So. In terms of just describing the experience that a woman would go through, the first thing I want to just touch on is the fact that before we ever see a patient hit our office for a treatment, we always get them in prior for a thorough assessment of what their concerns are, because it's really important that they have a thorough and accurate exam by a trained practitioner that specializes in this area to be able to really look at, what's the problem, what's the underlying cause of her pain or her dryness or her other symptoms, so that we can make recommendations for the options that she has to choose this. As I said earlier, it's really important that patients have choice, and this is one choice, but we want to make sure that it's a good choice for patients. And so it's really important that you have that expert assessment done prior to. And so afterwards, if we determine that the treatment is, the patient's a good candidate for it, they are scheduled for a visit and they're escorted into this very, very comfortable room. This room feels very calm and relaxing. It's much more like a spa than a clinic, so it has a totally different feel than what you normally feel in like a surgical, procedure room that most offices have. We have instead of a traditional exam table, there's this wonderful warm feeling leather chair that has a back massager and a heater to it to promote relaxation prior to the treatment.
And we have warm blankets.
We have warm blankets. So just getting the process started, even though the procedure is fairly comfortable anyway, being relaxed as you're going into it, because you're not knowing what to expect. So the treatment itself includes both an external and an internal treatment. And so the process starts by us applying a topical gel to the outside. And this is left on for about 10 or 15 minutes to allow that to work. And we start the treatment out by inserting a vaginal probe. You can see that attached to the machine here. And the probe is a gentle sized probe. It's slowly and gently inserted into the vaginal opening and advanced to the depth of the vagina. The tip of the probe has a mirror in it, and so the laser beam bounces off that mirror onto the vaginal tissue. And so we insert the wand and rotate it 360 degrees, and then withdraw it slowly about a centimeter at a time. And each time we withdraw, then we make that 360-degree circle again, so that in essence, the laser beam treats the entire surface of the vagina. When we're done with the internal treatment, then we put on another attachment to the MonaLisa equipment, and then we go ahead and do the laser treatment to the external genitalia. So that's the inside lips, at the opening, that region. Most patients, the whole therapy actually takes 5 minutes or less. Most patients describe the sensation of getting the treatment done as a vibration or a tingling, or a little bit of pressure. That's what most patients say. Afterwards, we ask you to put on a lubricant to just keep the area moist and comfortable, and you're given an ice pack to use for the next few hours. Most patients are able to return to pretty much normal activity almost right afterwards. Most patients, if they're having some mild discomfort, that feels back to normal within a day or so. We do ask that you avoid intercourse, however, for about 48 hours after the treatment. But otherwise, there really isn't any downtime, and patients are able to return to normal activity very soon afterwards. So it's a fairly simple, straightforward treatment to go through.
Yeah, it's been really straightforward. I think, too, we call and check on all our patients, certainly even sometimes that night or the next day, and they'll talk about maybe it stings to urinate the first couple times, because we really try to get pretty, not in the opening of the bladder, but pretty close. And, it might sting for a little bit, but that's it. We recommend a little aloe vera jelly, even, or just a little bit of lube, or a little lidocaine sort of jelly. And truly patients have said it's really no big deal, which of course I hate to cause pain. So this makes me really happy that patients are comfortable during it. On the outside too, they say it may even feel like a little rubber band. And again, for any of you who have had laser therapy at all in your face for, wrinkles or hair removal, it's very similar to that. Lasers have been around and used in medical therapies for a long time. Which brings me to the next sort of topic, that this laser is approved by the FDA for medical use. It's not approved for a specific indication. And so one of the questions we'll get is the MonaLisa covered by insurance? How insurance tends to work is that it will pay for a treatment that's approved for a specific indication. So for example, estrogen is approved for hot flashes by the FDA, insurance will pay for it. So the MonaLisa is certainly approved for use in the United States, but again, it's not approved for a specific indication. So it's not directly covered by insurance. And so, it's something that when you come for a consult, we can talk about the charge, we can talk about, a potential payment plan. And the treatment is recommended for 3 treatments in the first year, a month apart, and then 1 treatment 12 months after the first treatment. So like we have written here, 4 to 6 weeks apart. And then the last treatment, every year after starts at 12 months after the first treatment. So, in talking about this, it's thinking about, initially in terms of thinking about the cost, it's also comparing to what you might pay in co-pays for medication for estrogen. Now, again, this is equivalent to estrogen. So if estrogen, you're using vaginal estrogen or systemic estrogen is working for you, the MonaLisa wouldn't be indicated. But if you want a different option, or you're not able to use estrogen or intravaginal DHEA, or you're not, then this is an option. And again, over the time of your lifetime, you can help rationalize that the cost will equalize out. So it's just a different way to think of it.
When you consider, some of the vaginal products that we use are a $50 a month product, and so at the end of every year, you've invested $600, and so, so if it's a treatment that you think is right for you and it fits, working through it in that way sometimes makes sense. Depending on what your health savings account and FSA, things like that, you have to check what the criteria are for your particular plan. But occasionally, it even falls into that category. But
exactly. And I hate talking about money. I hate talking about all this because we just want to get this in the hands of people, and we want people to not suffer. So, it definitely could seem like a barrier. And so we want to make sure we at least bring it up and we're comfortable with it. But I wish we didn't even have to talk about that aspect of this. I know, this MonaLisa was developed in Italy, and as I understand, it's a covered benefit in Italy. Helen, I don't know if it's a covered benefit in Australia. I sure hope it is. And again, all women deserve this, and to not have to suffer with painful intercourse.
Yes.
Susanne, is there anything to think about in terms of who might not be a candidate for this?
Yeah, I mean, most women are candidates, but things like someone has a prior history of being a poor wound healer or forms scars called keloids. That sometimes makes patients not as good of a candidate. We would not recommend it in pregnancy or within 3 months of delivery. If a woman had severe prolapse of her vagina, sometimes it would not be indicated. Again, we would determine that on that exam that we would do previous. Patients who have had radiation to the pelvis, if the tissue ends up being permanently scarred afterwards, sometimes will not get adequate relief from it. So we would, again, evaluate that prior. Patients who have had previous reconstructive pelvic surgery using a mesh sometimes aren't as good candidates. We usually wouldn't treat you during an acute infection, like if you had an active STD or an active yeast infection. Not that you can't get treatment. We would just want to treat that first and then see you back at an appropriate time.
Right. Or if somebody has had like the vaginal herpes, we'd want to make sure you're on preventative treatment beforehand.
Yes.
Of course, a condition that's very common. So we'd want to make sure someone's getting treatment before they get the MonaLisa. We wouldn't want the laser to trigger an outbreak. That would not be a good thing. So we want to make sure you're treated before you come in. And again, these things we just have to talk about. It's so important to talk about these things and make them more normal. Right, Susanne? Like,
yes,
just so important.
Yes.
Yes. And so, in saying that, I just want to bring up a patient. I'm not going to use her real name. She has given me permission to talk about her story, but I'm not going to use her real name tonight. But we'll just make up her name as Debbie. But, Debbie is a patient who had breast cancer. Just again, like Susanne said, breast cancer or any cancer tends to cause so much distress in terms of the treatment process. But, we're so lucky that treatment has gotten so good that so many women survive their breast cancer, even if it occurs at a young age. And this patient, will make up her name, Debbie, she was 42 when she was diagnosed, and she and her husband had a really good sex life. And going through treatment, it was really difficult. She was very tired. They weren't as intimate, but they stayed close with just cuddling and hugging. And, he was just lovely. And she said he was so cute. He kind of, as she was feeling better, he was like, I don't know how to bring this up, but I really miss being close to you. I really miss our sex life. And she said, I don't know what to do. It hurts so bad. And it wasn't just that she had dry skin at this point. It was that they had tried to have sex a couple times, but it hurt so bad that her pelvic muscles started to get tight. And she also had bladder urgency. She was really worried even that she might lose urine while they're being intimate. So she's like, no style points for that. She didn't want to have any bladder issues either. And so it really became this awful thing that she was, mourning the loss of her, of so much with having had chemotherapy and surgery for breast cancer, that now with painful intercourse, she felt like she really, this was just too hard. And she heard about this treatment. She came for her first treatment, and after the first treatment, she came back for her second, and she had tears of, she said, you don't even know how much this has already changed our lives. The skin isn't dry anymore. It doesn't hurt anymore. Also, there's a product called the O-Nut. The O-Nut is a donut-shaped little soft pillow that fits around an erect penis that, they couldn't at first have intercourse all the way to the same depth, and the O-Nut protected both of them from, having to protect from too much depth. How to talk about this appropriately on Facebook, but to have too much depth. So the O-Nut was a way that they could progressively start to have intercourse again without her pelvic muscles spasming. I also recommended that she use vaginal Valium which was really helpful to help relax those tight, scared muscles, to resume intercourse. And so with the MonaLisa and the O-Nut and the vaginal Valium, they were able to start to resume intercourse. And after the second treatment, I expect that she'll get better. And then after the third, even better yet. So she said it was life-changing and relationship-saving. So I think those are really good quotes to reflect the results of the MonaLisa.
Yeah, we've been getting such impressive results. It's just so much fun to be able to see patients after the treatment. And many times after just the first treatment, patients come back and they're like, I was able to have comfortable intercourse for the first time in years. And so it's just so rewarding to be able to see the results. The other thing I just wanted to say is the example that you gave, Dr. Bitner, I think is a really good one. It really kind of spells out the importance of having a thorough assessment to figure out what are the root causes of the dryness and pain.
Thank you.
That you have this whole person oriented type of plan for it, because that example, is a good example that shows that MonaLisa by itself probably would not have given her optimal results, but a thorough assessment showed that she had some other issues that also needed to be treated. And when we roll that whole program out to the patient in terms of a good treatment plan, that's really what got her optimal results.
Thank you. Sometimes I think I take that for granted, but with my experience as an OBGYN for 26 years, for you as a PA doing primary care and then specializing in cancer survivorship, we really do provide this full evaluation of care. And what I worry about is, like you say, when this laser is done by providers who are good doctors, but this isn't their lane, that's what I worry about, is that you might have a laser treatment by another provider and think that the MonaLisa or the therapy didn't work. MonaLisa only sells to pelvic floor, to gynecologists who this is their lane. So you might have another laser therapy by a provider who's not a gynecologist or a women's health specialist. And you might leave the experience and say, well, the laser treatment didn't work. And to Suzanne's point, if you had also high tone pelvic floor spasm or high tone dysfunction, then again, you wouldn't think the MonaLisa worked or the laser worked, but yet there were other things at play. So, thanks for making that point. It's just so important. And we've addressed these points again on our website. If you go to our website, truewomenshealth.com, we're going to put up the link here. There's a specific landing page just for the MonaLisa Touch. We give a very thorough description of it and also of the commonly asked questions. There's a place that you can email us with any questions. Our number is also right on there if you want to call for a consult to come in and see Suzanne and have a consult about the MonaLisa Touch to find out if this is right for you. Or you could just email us directly for more information and we can get back to you. Again, at True Women's Health, we take your privacy very seriously. So this is all done in the comfort of a spa-like setting with warm blankets and spa music. And, we're just so proud of our team. Also, we have gift certificates on our website if you want to purchase this for a loved one or for a partner. Maybe this is a way that you can kind of bring up the subject without getting in trouble, and make this a little bit more comfortable.
I think it's a great idea for a Christmas gift for a partner.
Exactly. I love this. So thank you everyone for your attention. We're so glad to bring you this Let's Chat about the MonaLisa Touch. For further information, again, check out our website, and we so look forward to seeing you at True Women's Health.
Thank you.